Yeah, I'm here once again. I shall be talking on issue of hematocrit, issue of blood volume. Yes, as we all know that everyone needs adequate supply of blood, which is physiologically pumped by heart. Yes, blood is a basic nutrient in the body. It is a tissue that harbors so many nutrients. Then upon the mechanism of the heart rhythmic condition, blood is pumped to the tissue bed to various parts of the body to somehow supply all the cell lines, tissues, and organs of the body. Yes. However, when blood volume is in excess, it induces a disease condition that could be fatal. Yes. Reference range of blood in men is put at 40 to 56%. But in clinical practice, you will quite agree with me, any hematocrit, peak CV or blood volume that exceeds 45, individuals start having some clinical symptoms like headache, malaise, and pains all over the body, previous condition. But at that range, it is still regarded as a normal range of blood volume in the body. Yes. I have to simplify it so that everyone will understand what I'm talking about. So I'm not just going to be using some medical deductions. Yes. Well, blood volume is measured as packed cell volume or the level of hemoglobin. Yes, can be used to measure the volume of blood. What are the clinical symptoms or the clinical effects of excess blood volumes? That is the issue of today that I want to actually deliberate on. Blood volume is a basic fluid needed in the body, at least for life processes. Yes, so many things are carried in the blood, so many things, but that is not what we are going to do it on now. What I'm focusing on is the side effects of excess or raised blood volume. Some individuals on their own ordinarily induce unnecessary production of blood by their by their method of dietary intakes or even drug intakes. Some individual just indiscriminately takes, an adult takes milk, egg every day, even meat. You take it so indiscriminately. When you ordinarily make tea, which must contain milk, is the milk that mostly raise blood volume. So expect that in the nearest future, that your blood volume will be so raised. When you go to hospital, they do your hematocrit, do PCV for you to know the level of blood. If it is 50%, inexperienced doctor may tell you that You don't have much problem. Yes, even when you came there with the ailment, you came to complain that, oh, look at how you are feeling. You're feeling headache, maybe sleeplessness. Sometimes we're having palpitations and all that. Yes, individual, especially male individual, that is blood volume, the PCV is attaining 50 or little above 50, let's say 51, 52. Such person have that likelihood to be having palpitations, discomfort, then hypsonians, that is sleeplessness. So what it means is that the, the volume of blood in the vasculature, in the blood channels and the heart is so viscous. And because of the viscosity of the blood, because of the thickness, that what I mean by viscous, because of the thickness of the blood, there is a slow movement of blood within the blood vessels, which is called blood stasis. Yes. The normal blood flow in the body is called laminar flow. That's the normal blood flow. Individual having laminar flow of blood will never have any clinical symptoms. Yes. There are certain indices, certain cardinal effects of raised blood volume. Most notable effect is high blood pressure. But in some very rare cases, it could lead to low blood pressure, especially if the kidney is finding it difficult for its normal ultrafiltration. Yes, because of the viscosity of the blood, it could also disturb the physiological functions of kidney. Yes, and as such person may develop a low blood pressure. It is most times rare with individual having excess blood volume. To me, I will suggest or prescribe that male individual blood volume should not exceed 45. Even though medically it is proved that the normal range is between 40 to 56. Yes. So once it falls within that, and you meet a clinician that is not so experienced, for instance, maybe your blood volume falls within late 40s to early 50s, and the person is still saying you have no problem and all that, you will want to take a measure that will prevent further rise in blood volume. Such person may not be consulting such patients very well. Yes, because different ranges as per blood volume, when they say 42, some people might be comfortable at 45, some may be comfortable at 46. Yes, different range does not just mean that, oh, it must be all the time 50, even when it is 15 in the male, 50% in the male, that such person may be comfortable. No. But throughout my practice, I have observed that a male blood volume that exceeds 45, such person do normally have some clinical symptoms, like constant headache and disturbed sleep, a malaise, feverish condition, and all that. This come about due to lamina, due to blood stasis, due to low flow of blood within the vasculature, within the blood vessels. Yes, and as such, if not controlled, such person could have a major clinical consequences. Yes, especially if the individual does not know what is actually wrong and still keep on taking certain foods like milk, rich foods like milk, egg, meat, the blood volume keeps on rising. Or some people on their own buy hematins, buy blood medicine, and start taking just self prescription. Some will feel, oh, their skin is rough, oh, they are not shining. We want to buy blood medicine so that their skin will be shining. And so they'll be taking this type of drugs. Some people want to increase their weight. Most people that take drugs to increase their weight know that most of those drugs still induce blood volume. Yes. And as such, if excess blood volume ensue, it could lead to one, cardiac incompetent. Yes. It could lead to heart failure. It could lead to mitral valve stenosis and cardiac incompetent, so that the systolic blood filings, that is the blood that comes out of the heart, will be slow in pumping out, and the drainages, that is diastolis, will even be slow. In the end, the amount of blood that the heart ought to receive per day will be reduced, and so could lead to myocardial infarction, death of the heart chamber, one of the heart chamber called myocardium. Yes, and as such, if such ensue, it is not reversible, it's not treatable, it's just management. Such condition is called heart failure. So what I'm trying to say is that excess blood lead to heart failure, and it can destroy the valves. It lead to mitral valve incompetence, and valvular stenosis. Yes, you know, making the valves of the heart to be narrowed. Yes, to be narrowed, and once the valves are narrowed and they become patent, so the physiological functions of the valve that normally open easily and close easily will be hampered, and as such, blood that comes to the heart will become inadequate, and, and it could lead to major consequences. The other consequences of excess blood, it could be stroke. So first of all, raised blood pressure could be induced, that's hypertension. And once it is induced, there could be vessel rupture. It could lead to an extradural hemorrhage, rupture within, and vessel rupture within the dural part of the brain and all that. Yes. Even the gyras, the parenchymas of the brain, will be so stressed because there's that likelihood of ischemia, that is blood not adequately supplied to the brain or to other part of the body. Yes, once there's ischemic heart disease as a result of the blood volume, as a result of the thickness of blood within the vasculature, that alone can lead to vessel rupture. And once there's vessel rupture, in fact, it will need surgical resection. Most people don't even survive it. Yes. And neurovascular accident, paralysis. Yes. Paralysis is called neurovascular accident because there's that likelihood of pressure created. When there's pressure created within the vasculature, as the blood vessels and the heart, so it could induce a kind of cut in any of the nerves. Yes, once a nerve that supply any organ or that cut, that is paralysis. Yes, it is high blood pressures that lead to paralysis. So know that excess blood volume could lead to paralysis and could lead to one, blood vision. Yes, blood vision. What I mean blood vision, the individual not seeing well. Many ailments like diabetes also lead to blood vision. Inflammation, that's infections, can also lead to blood vision. Yes. So what I mean blood vision, individual not seeing where the sight not so clear and all that. Yes. So it is always good that to moderate our dietary intake so that our physiological well-being will be well maintained. Yes, that is the normal functioning of the body will be well maintained. So we don't unnecessarily eat. See what actually killed a lot of Africans immediately, and after immediately we were given independence. Some people that had money, real money, and they were eating anyhow because they had money to buy all things. Some could buy cellophane of suya, eat it, fry egg every day, take milk, take tea. An adult, you must moderate intake of milk. Yes, milk is basically meant for children. Children needs it daily, and so they are unlike adults. And so one should moderate all this intake because as food is, food also can kill. Yes. Now, how do you, in a way, slow down blood volume using food therapy? Well, I will advise that a male individual having the volume of 50, even 49, should reduce his blood, should donate to come to 45 because a pint of blood is 5%. Yes. But ordinarily, people may say, oh, it has not reached 56 because the normal range of at its it medically put is between 40 to 56. But however, in clinical practice, you will observe that a lot of patients getting close to 50 are already having a lot of trouble, having a lot of symptoms and all that. Pains within the bones, all over the body, headache, sometimes sleeplessness, lack of sleep, rise in BP, tiredness, no strength, and all that. Such individual should realize that his blood volume should not exceed 40. But when it comes to women blood volume, medically it is put at 36 to 51. But however, a lot of women, once they exceed 40, they start having a lot of problem, a lot of clinical symptoms. Yes, some will be saying, what did they do wrong? Who is beating them? Because most people in this part of the world always believe in spiritual attack. Yes. But they won't even understudy their dietary habit and their social habits, whether it's contributing to their health and all that. So, and such individual, female individual whose blood volume exceed 40, blood volume is 42, 43, such person will be having a lot of problems. Maybe you go for lab work, they may diagnose malaria typhoid. It doesn't necessarily mean that malaria typhoid is your main problem. It may be there, but it's not your main problem. Because even if you treat the malaria typhoid, you treat it and it's eradicated, you will still be having such problem. Yes. So what I'm trying to say, individual medical scientists that make reference ranges don't know the reason why they make reference ranges. If they say 36 to 51, they know what they are talking about. Yes, that is for women, reference ranges of blood volume for females. I mean reference range in normal ranges of blood volume of female is 36% to 51%. That is how it is put medically. But I'm telling you, that in clinical practice, once a woman exceeds 40%, such woman will be sick. Such woman will be sick. Yes. Except such medical personnel has not practiced. There's a difference between practicalizing situations or what you just read at school. Yes. Yes. So I will advise that women's blood volume should not exceed 40. If you doubt me, yes, go and do your hematocrit, go and do your blood volume, go for a test. If your blood volume exceeds 40, you will know in yourself that you are sick. Yes, I'm talking about women. Yes. So now, how do you now reduce such blood volume? If a woman's blood volume is at 45, I personally will advise such woman to donate. Because a pint of blood is just 5%. Once you remove a pint, it will come down to 40. And such woman even need to be very careful. See, because it is hematocrit or PCP of a woman, for a woman to be comfortable, is mainly at 36, 37. Yes, for a woman to be comfortable, we have any clinical symptoms and all that. So that we should be very careful about our food intakes, our drug intake, drug that unnecessarily raise blood volume and all that. But if you are an individual who constantly slice garlic and onions in your food, it reduces, you see, garlic and onions reduce blood volume and make the heart competent. So it allowed physiological function of the heart to take place properly. Yes. So when I say garlic and onion, it's not when you eat it once and the next 2 days you eat it, you will have any effects. If you want to use it to reduce blood volume, you must take it twice daily, constantly for weeks, for about 6 weeks. Yes, because you are not directly removing the blood. Otherwise, you should just donate. Donate. If you want quick recovery, donate. Then some persons try to use certain antibiotics or drug to reduce blood volume. It is very wrong because most of these antibiotics can change the blood picture. When I mean blood picture, the blood structural outlines, because blood has its own normal structure. Once the normal structure of blood is altered, it can lead to so many diseases like cancer genesis and other abnormalities. And that is why it is always good. It is better off either you donate or use this agent these recipes are just listed, onions and garlic combined. You take it morning and evening, raw onions, not cook. Yes, you take it morning and evening because it's going to enhance functionality of the heart and reduce blood volume because they are blood thinning agent. Yes. So what am I saying? Excess blood volume can lead to one, uh, polycythemia vera. Yes, polycythemia vera. What I mean by polycythemia vera, cancer of the red blood cells. Immunity cancer, most cancers are not curable. And what other things that raise blood volume? It is not just food that raises blood volume. You see, punctuated sleep, what we call sleep apnea. Sleep apnea could come on board due to maybe heart diseases like BP, diabetes, and other heart diseases. Yes, yes. Once you are having disturbed sleep, you don't sleep well. Don't be surprised that your blood will be rising, or you ordinarily deny sleep. For instance, a lot of pastors who wake up mostly at night, pray all through today, and they will think they are doing themselves good. No. So you have indirectly induced, forcefully induced what I call sleep apnea. Deny yourself sleep. So what will happen is that there's going to be gross increase of blood volume. So what I'm telling the public now is that it is not only foods, drugs that raise blood volume. Yes. Sleep apnea. Sleep apnea means disturbed sleep. When you don't sleep properly, it could raise blood volume unnecessarily, and that could be fatal. Yes. That is why when you have any heart-related diseases like hypertension, cardiomyopathies, rheumatic disease, and diabetes, atherosclerosis, and many more, treat it so that you will not necessarily be experiencing sleep apnea. You will not necessarily be experiencing disturbed sleep. Yes, this is my message today. Blood is one of the basic tissue in the body. It contains all nutrients and it is pumped by heart. The function of the heart is to distribute blood to the tissue bed, that is to all the tissue. The heart rhythmic condition, the heart pumping action, pump blood to the tissue bed. That is, pumping blood means it supplied blood, supplying nutrients, because blood contains nutrients that the body needs. Yes, supply nutrients to all parts of the body. But however, when blood is in excess, it becomes very fat. It could lead to, you see, dangerous diseases, heart failure, kidney failure, blindness, cancer, paralysis, and many more. Thank you for listening.